give thanks again to Commissioner Terry Allen, Dr. Heidi Gullett, and Deputy Director Ramona Brazil for all the great work that they do. They are truly saving lives here in Cuyahoga County. 3 million coronavirus cases and 132,000 deaths nationwide. The surge is catastrophic. And we're right in the thick of it here. According to the state, we're at red level 3 and going the wrong direction towards 4. Our cases are skyrocketing, our emergency room visits are skyrocketing, hospital admissions are going up, and things are getting worse. We've got real trouble. We've got to take serious steps to stop the spread. Just this week, Dr. Fauci has warned that many states should pause their reopenings or shut down entirely. Now, we don't want to do that. The economy has already been seriously damaged. So to strike a balance, I proposed an ordinance to County Council that requires people to wear masks in public places. The city of Cleveland adopted a mask requirement by order, and the state issued a health order requiring masks in the red counties. Commissioner Terry Allen, Dr. Heidi Gullett, and Ramona Brazil have said many times, wearing a mask in public, especially indoors, but also in some outdoor gatherings, is a necessity. It's a necessity as we work through this outbreak. Masks work. They can reduce transmission of the coronavirus by up to 75%. I applaud Mayor Jackson and I applaud Governor DeWine for their quick, decisive action to try to get the spread back under control. I know there's been confusion about the state order and questions about its enforcement and about how city and county laws intersect with the state order. I'll try to address some of those questions today. Our legal research shows that a violation of the state order is a second-degree misdemeanor, punishable by up to 90 days in jail and a $750 fine. The order may be enforced by local officials. Now, I can assure you that no one wants to penalize people for not wearing a mask. While it's probably not necessary since the state issued its order, cities may still adopt their own mask laws if they choose. For example, Akron's considering its own ordinance primarily because it would then be able to enforce its own civil fines instead of the state's criminal penalties. And Cleveland's in a similar position. For those cities that do not pass their own law, the state health order controls. We've set up a phone line for compliance complaints. The number is 216-698-5050. That's 216-698-5050. You can also share your feedback and concerns through our online form at cuyahogacounty.us/mask experience. If you see situations where people are not following the mask mandate, you may call that number or go to that web address. We recognize that other agencies like the Board of Health will probably receive calls too. But we would like to do our part to support this health order and allow Terry Allen and Dr. Gullett and their colleagues to focus on the work of contact tracing and testing as much as possible. When we receive information about mask compliance issues from the community, we intend to contact a business owner if relevant, or the relevant individuals to let them know that information has been received. We also intend to inform the local city, village, or township as well. If repeated complaints are received or serious non-compliance is raised, under the state order, the county sheriff would have the authority to investigate and potentially take further action. Local law enforcement also has the authority to act, but it's our hope that this kind of action won't be necessary. We hope that informing the business owner or relevant parties will correct any compliance issues that exist. We hope our residents will realize that mask wearing is a necessity during these challenging times. Please help stop the spread. Just wear a darn mask. Now I'd like to switch gears for a moment and give an update on the county's rental assistance program. With unemployment at an all-time high, the county's looking at an impending eviction crisis. And with the pandemic in full swing, this is the worst time for a family to be thrown out of their home. So we partnered with CHN Housing, Eden Inc., and the city of Cleveland. We put in $6.8 million. Cleveland put in about $11 million. So there's about $18 million to help. In just over a week since applications opened, we've already received over 1,600 applications and over 3,100 inquiries about the program through the rental assistance hotline and website. It's clear to us that the need is there. We're listening to you and know you need help, and we'll continue to assess how we can further help those who are struggling both financially and physically in Cuyahoga County. To apply for the rental assistance program, visit neorenthelp.org. If you have low to moderate income, up to about $90,000 for a family of 4, and you're unable to pay your rent due to COVID, visit neorenthelp.org, and you may qualify for up to 3 months of unpaid rent. Thank you again to CHN Housing Partners, Eden Incorporated, and especially the City of Cleveland for their important contributions to this program. Finally, I want to let you know that the services you expect and need from your county government are available despite the pandemic. Either in person or virtually, these services are available. Here are a few examples. If you want to review, transfer, or record a deed, you can do that at the county headquarters. You can do it online, or you can do it by phone. If you want to pay your property taxes, you can come to our downtown office or do it online. The deadline for the second half of 2019 has been extended to August 13th, 2020. Our auto title offices in Bedford, Mayfield Heights, North Olmsted, and Parma, they're all open. If you have a consumer problem, contact Consumer Affairs online or over the phone. The Jane Edna Hunter Building, where our Division of Children and Family Services is located, has remained open for walk-in referrals for child abuse and neglect. And the DCFS hotline still operates 24/7, 365. For help, call the hotline at 216-696-KIDS. That's 216-696-KIDS. You can access all eligibility services for Medicaid, SNAP, and cash assistance online and over the phone during the pandemic. In fact, by working virtually, our staff has been able to improve efficiency, reduce case backlogs, shorten wait times. The number for these services is 1-844-640-OHIO. That's 1-844-640-OHIO. And starting July 27th, limited in-person services will be available for these programs in the lobby at the Virgil Brown Building. But we still recommend using the online and phone options to get services. That'll help keep down the wait times. All child support services are currently being offered. This includes establishing paternity, genetic testing, and establishing and enforcing child support orders. These services will be available in person at the Virgil Brown Building Superior Road entrance, but appointments are necessary. Our Division of Senior and Adult Services has continued to provide services to protect seniors from abuse and neglect via phone calls and emergency home visits when necessary. Seniors are still receiving home-delivered meals, transportation, homemaking, personal care, emergency resources, and chore services through our Options for Independent Living program. And there's many, many more services we're providing too. Despite COVID, your county government is providing the services that you need. Thanks go to our county employees for continuing to serve well during the pandemic. Thank you.
Thank you, Executive Budish. I'm Terry Allen from the Cuyahoga County Health Department. I'm the Health Commissioner. and we're appreciate you spending some time with us today. We appreciate your leadership, Executive Budish, and support, particularly with this really important order we received from the state as we work together as a county, as communities, to protect all of our citizens, particularly the most vulnerable. I wanted to start off by saying that I'll be beginning with some comments and brief comments, followed by our co-director of prevention and wellness, Ramona Brazil, and we will wrap up with Dr. Gullett, Heidi Gullett, who will provide some information as well. And so we'll begin. First, if you go to our website at ccbh.net/coronavirus, you'll see we have a new data brief that's been published, and we'll be referring generally to some of the information that's on that data brief as we move through this process. As Executive Budish mentioned, Cuyahoga County, along with a range of other counties now, I think 12 in total, are counties in red or level 3 in the governor's COVID rating system. Level 4 is the highest, which is purple. It's important to know that just this week, Cuyahoga County will remain red, but is on the watch list for purple based on some concerns about increases in hospitalizations, along with, of course, watching whether we see any increases in ICU bed utilization. There are actually 7 factors that are used to make this determination and considered in the rating system across the state. The first is looking at the number of new cases per capita and how that changes over a 2-week period, whether there is a sustained new case growth in that time over a 5-day period, and the proportion of cases that are in non-congregate facilities. Again, congregate facilities, we've learned, are places like nursing homes and long-term care facilities and adult care homes and the like. Looking at the proportion of those that are new cases that are outside of those facilities, which we know are of particular risk. Also looking at sustained increases in emergency room visits, increases in outpatient visits, as well as what I mentioned earlier, sustained increases in new COVID-19 hospital admissions. And of course, the last rating is tied back to intensive care unit bed occupancy. So these are all critical factors that are assessed in the rating system. We know the governor, as Executive Budish mentioned, has recently passed the order on July 8th that orders masking in counties that are red or purple. We think this makes good sense. We know that masks save lives, and we'll talk a bit about that. We have been running, and the data is now showing that this transition in this rating is justified. We are very concerned about the surge that we're seeing in cases that has been sustained over the last few weeks. Cases every day in our jurisdiction alone, well into the hundreds. And Ramona Brazil will speak to some of those details. I know just yesterday, reports from the city of Cleveland that they had 100 cases themselves in one day, independent of our data. And so there have been some sustained new highs across the entire county, which is very concerning. So we know we're trending younger, and we'll talk a little bit about that, seeing lots more younger folks without masks, taking risks in a number of settings where they're gathering together, traveling and the like, and Ramona will describe some of the specifics that we're concerned about. But we need to remember that our young people are not invincible, and that their actions have consequences for our seniors, for our grandparents, their grandparents, and for the child down the street who may be battling leukemia. They may come in contact with them unknowingly, being asymptomatic and potentially transmitting to someone that they love, that they care about, and maybe even somebody they don't know, and no one wants to be in that circumstance. We've now tracked well over 14,000 cases and contacts in the 58 communities we serve outside the city of Cleveland, and the city of Cleveland has also tracked a large number of cases, we're aware, in our regular discussions with the city of Cleveland Department of Public Health. Our call center is averaging between 200 and 300 calls every day for a range of issues, public concerns about testing, concerns about crowding in different office settings, masking for workers, social distancing, a whole range of questions that come in from the public, and we've been doing that really since the beginning. We also heard from our partners at Metro Health that their COVID helpline has tripled in volume. So we're seeing this sustained public interest and concern, and the masking mandate, the masking guidance is really falls in line with what we're seeing in our community. The concern is rising, the risks are rising, and we need to act. Also, we've seen an increase in the positivity rate of cases in multiple weeks in a row. And Dr. Gullett can talk about this trend. It's in our data brief. But the positivity rate in cases is rising because we're seeing more young people that are acquiring COVID-19. It isn't just in Cuyahoga County. This is happening in the state, across the country. It is a national phenomenon, and it's very concerning. So the governor did report that the average number of emergency room visits has doubled and outpatient visits have quadrupled in our county. This younger trend of people then coming into contact with those that are fragile could increase hospitalizations and ICU bed utilization. And there's a lag of several weeks that often occurs before we start to see this utilization and hospitalization increase. And we're concerned that they could lead to and portend increases in fatalities. That's concerning to all of us. We don't want to go through the tragedy that New York City experienced, nor do we want to face what Arizona and other states are facing right now. The hospital surge could lead to clinicians having to make impossible choices about who gets a ventilator and who doesn't, who gets life-saving procedures and who doesn't. No one wants to face that prospect. As Executive Budish noted, there are multiple studies now, over 20 studies cited on CDC's site, a study, what they call a meta-analysis, a group of 172 studies that were assessed on masks. And all these studies are indicating that masks are protective, they work. And some studies now indicate that they may reduce viral transmission by as much as 75%. In our communities and in our workplaces, we need to operate as if each one of us may have COVID. And so our job is to protect others from us. And if we all operate that way, we can make a difference. We're now at the stage of an education campaign around the new masking requirement. And so I think back, having been here for 30 years, when the smoke-free law passed, we spent quite a bit of time educating the public about the importance of smoking outside and the importance of not exposing workers to risks in those environments and reducing our overall healthcare related costs and poor health outcomes, which directly affects our economy, affects our productivity as citizens in Cuyahoga County. And where are we now? We actually have incredible compliance with the smoke-free law. People understand that it's protective and they're following it. And I think that's a testimony to a strong public health education campaign. And as Executive Budish said, we are working with our partners in the cities, working with our county partners at the Sheriff's Office and in county administration. We appreciate his support of our work around case investigation and contact tracing by standing up a phone number and an online portal to assist with concerns the public may have. And so we're going to work with Executive Budish and his team as we have from the beginning. And we will work with our local partners as we have from the beginning to make sure that people know that the smart thing, the right thing, and the protective thing to do is to put on a mask and do that for your family, do it for your community, do it for the other workers in the restaurants and places that you visit, and do it for Cuyahoga County's economy. If we're all protecting ourselves, we can move forward and we won't be paralyzed by challenges as our schools open, as sports activities move forward, as a range of other considerations and events take place in our community. The way we get closer to normal is through masks and making them part of a normal activity in the way that walking outside for those that choose to smoke is our way forward, the only way forward. So with that, I'm going to pause and turn things over to our Co-Director of Prevention and Wellness, Ramona Brazil.
Thank you, Terry. So I want to focus on what's been happening with our cases and our contact tracing as we try and manage the surge that we've seen over the last week, really almost 2 weeks now. So this week we received our highest number of cases to date since our response began. We received 747 new cases this week alone. Our previous high was 730 cases that we received the week prior. We have received more than 100 new cases per day in the last 6 out of 7 days. So it's been a real challenge to be able to respond adequately because we feel like time is of the essence when we receive a report. We really want to contact people either the same day or by the next day at the latest. We also want to highlight disparities and inequities. And last week was the first week where we saw the percentage of cases reporting as African American equaling the percentage of cases who identify as white at 43%. We also are still seeing a higher rate of hospitalization and ICU admission for those who identify as Black than compared to other races. As Terry mentioned, younger people are now making up the largest group of our cases. 1 out of 5 people who have been diagnosed with COVID-19 in Cuyahoga County are between the ages of 20 and 29 years of age. And our median age at diagnosis has decreased from 50 to 47 last week to this week, 44 years of age. So we really are starting to see a lot of young people who are being diagnosed. And anecdotally, what we're seeing is a lot of travel. Out-of-state recreational travel is beginning again, and people are traveling and returning ill or shortly after they return back to the state. We also see people working multiple days while sick. Who may go get a test. So one of the important messages that I would like to share today is if you feel like you've been exposed to COVID-19 and you go get a test, then you really need to limit your exposure to other people at the time when you get the test done. So what we've seen are people who go and get a test, and while the test result is pending, still kind of continue their normal activities, going to work or attending social gatherings, and then finding out they were positive after they've been around other people for multiple days, and as well as attending social gatherings. So we're still seeing dinners and parties, birthday parties, graduation parties, things that seem really innocent at the time. And we understand that people have that desire to see their loved ones again, but it is posing a risk to everyone who attends that gathering if somebody just so happens to be sick, and a lot of times are not even aware of it at that moment. In order to meet this demand, has been a tremendous push from the health department to meet that demand, and we've pulled staff from their programs and field work to help contact cases. We've prioritized contacting new cases at this point. And so there is some delay on who we can follow up with on contact tracing. So we are asking that people who have been diagnosed with COVID to help us by notifying their potential contacts as we prioritize contact tracing in those vulnerable settings like child care centers, long-term care facilities, and group homes. So just to reiterate, we really do want to stress the importance of using every tool that we have, every public health strategy that we have to reduce the potential for transmission of COVID-19 in our community. And we understand that it's not perfect, and we understand that people are starting to get tired. They've been doing this for months, but it's really important that people chip in by wearing a mask, by continuing to social distance, and by using good hand hygiene, and not going to work when they're sick. And with that, I'll turn it over to Dr. Gullett.
Thank you so much, Ramona. I'd like to thank all of our media partners who continue to report tirelessly on the impact of this pandemic in our community. We really appreciate the messaging you continue to provide and the partnership that you have given us all the way from the beginning in March. I'd also just like to return to a moment of gratitude, which is customary when we have our press briefings. And in my mind, it should be no different over Zoom than it is when we do them in person. And that I'd like to just really publicly thank the staff at the Cuyahoga County Board of Health for the incredible amount of time that they have given as we've experienced this surge. This is not easy. We've got to maintain what we call continuity of operations, which means we need to make sure that we're still doing all the regular public health activities. And our team here has been incredible at doing that, as well as taking on all kinds of new just-in-time trainings for activities that they've never done in their public health careers, but which are important for our community. So From my perspective, I just want to publicly thank all of my colleagues here for all the work that they have done since the beginning, but especially over these last few difficult weeks. I'm going to talk for just a moment about the hospital utilization. You will recognize, as Terry mentioned earlier, that hospital utilization, meaning how much we're using in the hospital with regard to beds and ventilators and things like that, are important considerations, and we've been presenting them to you since March on a weekly basis as we consider how this is impacting our community. So we present again today the trends that we've had, but you'll also know that what's increasingly important now is that one of the parameters around ICU admissions is actually one of the things that the state is using to color code the severity of the impact at the county level. And last week, when these data were published on the 6th, our community was just below the threshold for the ICU admissions, and we have crested over that as of this morning. So I'm going to just talk briefly about these hospital utilization data. They are the same that we've been presenting and trending since the end of March when these first became available through the Ohio Hospital Association. We also remain incredibly grateful to the OHA for continuing to provide those of us in public health with access to these data, which help us in our decision-making and collaboration with our hospital partners. This week, our adult medical beds are at 80%, which is a slight rise from previous. We had a 3% increase in the number and the percent utilization. So that's the total number being used versus the total number available since last week. For the pediatric medical surgical beds, we're at 59%, which was an increase of 3%. While we have had some increase in pediatric hospitalizations related to COVID-19, they still remain quite low and do not account for the increase in the number of hospital admissions for children that we've seen in our community over the past week. We have, however, as I mentioned earlier, seen the increase in critical care utilization, and we are up 5% to 82% of our ICU beds being currently occupied in our county. That crests over the threshold of 80% as one of the criterion for moving to the next level, and for us that would be the purple level. Ventilator usage remains a little bit lower than it was last week and remains around the 30% range. You'll remember we had a bump at the beginning of April to 55% utilization of ventilators, and that's the highest we've been. And we've been in the 30% range since then. We're at 32% this week, which is 6% lower than the past. And the number of ventilators has remained stable, which is important to also consider. Finally, our amount of testing has been very strong in our community. We're very fortunate to have several hospital labs, which have given quite a bit to our community with regard to testing, and we're very grateful for that. But the amount of testing this week was really an anomaly compared to prior weeks in recent memory. We have about 3,000 less tests this week than we have in the last few weeks. And part of that we attributed to having a holiday, which for some organizations was Friday and Saturday. We also know that some people may not have sought out testing because of the holiday. But what that means is that we've had 3,000 less tests, and our percent positive continues to dramatically rise. And so the results of these increased infections that we've seen, that you heard Ramona talk about, the absolute numbers of infections for the week, as well as the percent positive, do not reflect simply an increase in testing. Quite the opposite this week. It was actually a decrease in testing. That's very important. Our percent positive is a figure I've been talking to you about for many months, and that's to make sure everyone understands that's an important figure we follow to understand the impact of this infection in our community. Many folks feel like under 3% recognizes that things are doing pretty well. We actually had been pretty high in March and April and May. We had limited testing then, and then over the past few weeks we had been lower. And in fact, last week we had been 2 weeks ago at 3.7%, and then last week at 5.9. We are at 8.8 this week. And that actually represents an average. Some of our labs were significantly higher than that. And so it's important to recognize that means that there is a lot of infection in our community. And that means that all of us have to do our part as individuals, but also the organizations we work with, and the organizations that we patronize. We all have to do our part. So I'd like to finally end by having a call to action for my fellow healthcare providers. These are all the colleagues that all of us work with: fellow physicians, nurses, nurse practitioners, physician assistants, respiratory therapists, all of us in healthcare. We have got to lead by example. We have got to recognize the importance of masking, and we need to recognize how important that messaging is with our patients. A number of our professional organizations across the state of Ohio have unveiled masking messaging for us in our practices, and it's critically important we use that messaging. So it's masking and social distancing work, but we need you to be ambassadors also by example, and we need you to mask whenever you're in public, whenever you are with a patient and talking about how important this is. We're in the business of prevention here in public health, and we need your partnership at this time in that messaging. With that, I'll turn it back over to Terry for the end.
Thank you, Ramona and Dr. Gullett, for your presentation. To wrap up and turn it back to for facilitation for question and answers, I just wanted to say that several things we've learned. That in our facility here, we have been modeling the behavior we wish that folks will follow around masking and social distancing and staying home when you're sick and promoting remote work and surface cleaning on a regular basis. What that does in your workplaces is it reduces the risk for transmission among employees in your workplace substantially. It works. And so that's something to take to heart. Masking is a critical part of that scenario. The other piece is, with the support of Executive Budish in our communities, as we work to conduct this education campaign around the importance of the mask requirement and what it means to protect health. Businesses can do something simple. They can post a sign at their entrance that says, "Mask required upon entry." That we've already seen that point in action where people begin then to understand that this is a requirement, and they go back to their car if they happen to be at a door, and they get their mask and they walk in, or they pull it out of their pocket. And so people are accustomed to understanding the rules in a particular location. If you do that before people enter an establishment, you can go a long way to increasing mask utilization. The governor has said 80 to 85% of us using masks would be fantastic. It really helps to reduce that risk. And understanding that there may be medical reasons or other reasons, as noted in the order, why people can't wear a mask, but most of us can. And we can do that because it's the right thing to do. So with that, we'll pause, and I'll pass it back for facilitation in our question and answers.
Hi, this is Anna Huntsman from IdeaStream. Can you hear me?
Yes. Hi, Anna. Go ahead.
Hi. So my question is about sort of the enforcement of the mask mandate in the county. So will you be relying just on complaints from people who call that number or who go online in that form? Or will people be out in the community sort of monitoring gatherings or monitoring businesses, or what does that enforcement look like?
Well, let me first start by saying, this is not intended to be going out and finding people that are not wearing masks. Nobody wants to be enforcing this. We want people to wear their masks. That's what's important. We want people to do it voluntarily because that's the right thing to do to protect themselves and the community. Having said that, there's not enough people, in law enforcement throughout the county to track down people, and chase them around and try to figure out, who we can go after for not wearing a mask. We will rely heavily on the complaints, on the comments that people leave on our telephone line. People can call their local city hall, they can call their local police department, they can call the sheriff's department. And as these comments come in, especially the ones that are the most egregious, then we will take steps to enforce it.
Okay, thank you. And just kind of as a follow-up, I have seen some local police departments in the county say that they don't want their, lines to be overflowed with mass complaints. So would you recommend people go to a certain place first before they go to that, or what do you have to say about that?
Yes, that's why we set up our mask number, if you will, for people to call in. And if I can find the number again, it's 216-698-5050. And people can call there.
Thanks.
Okay, thank you.
Good. Thanks, Anna. Whoever, would you just identify yourself for the next question, please?
Hi, yeah, this is Courtney.
Hi, Courtney.
Can you guys
Courtney
hear me?
Stahl.
Yeah,
We can hear-
yeah. Okay. I'm wondering, so Dr. Gollett today said we crossed the ICU threshold, the 80% utilization threshold, which is part of the governor's color system. That seems like that puts us in purple territory, correct? And if so, what's going to happen as a result of that? Are we going to see bars and restaurants shut down again now that it seems that we're in this most severe category?
You can jump in.
Dr. Gullah, do you want to answer?
I'll start off and Dr. Gullah can follow up, Executive Budish, if that works. So thank you for your question, Courtney. So that happened just this morning. As you know, there are periodic updates from the state on rating systems. There could be some fluctuations, as we've seen, on utilization of ICU beds, ventilators, hospitalizations. There's continual fluctuation. So I think we need to look at what some of that trending looks like, and I think that the system is designed to do that relative to rating. Having said that, this is a new issue this morning, and what it does is it highlights the reason why we're here talking to you today about the importance of masking, because it matters. And we know in other places, other states where they've had masking in place for some time, they are seeing lower rates of transmission. They are seeing lower numbers of cases, lower numbers of hospitalizations, ICU bed admissions, and ventilator utilization. And so it's time for us to take that to heart, because our trend is very concerning. And that's really the big picture in what we're talking about today.
Thanks, Jerry. The other thing that I would add is this is the time where all of us have to do absolutely everything within our power to be vigilant. And that means every single one of us, unless you have a rare exception for why you cannot wear a mask, need to wear a mask. This is where all of us need to do whatever we can to stay home if we don't necessarily need to be out. This is where we have the opportunity to limit travel if we don't necessarily need to go somewhere. All of us long for normalcy again, myself included, but this is not the time to take chances about any situation that could increase the risk of transmission. It might be that you yourself are not one of those people with a high-risk condition, but a whole lot of other people in your life probably are. And we don't want you to be the person that transmits that virus. So for me, this is just one piece of information that we're using. We're using a lot more information than even what you see on the state website. We're looking at whatever we can at the local level to best inform the public about the situation here. But this just means that we've got to be increasingly vigilant. None of us ever want to get to the place where decisions have to be made because we don't have enough ICU beds or we don't have enough ventilators. So we're hoping that we can use prevention with all of these new evidence that we're seeing that this is transmitting much more in our community to then flatten the curve so that we don't ever reach that surge capacity. That's what we never want to have happen here.
Thank you.
We have one more.
If no one else has a question, I might have a follow-up on enforcement.
All righty, you get the follow-up and you get the last question there, Courtney.
All right. Now I heard Executive Budish pretty clear and Commissioner Allen pretty clear about how you guys want to see these complaints go and enforcement go. Just to be absolutely clear though, are there any plans to send either health department folks out, sheriff's office folks, people employed with municipalities out to proactively monitor? I mean, are there severe cases where you will go out looking, or is it strictly response to complaints?
My view will be that every city, every community will do it their own way. Some may send people out, some may just respond to complaints. It's really up to each locality how they're going to handle the need to wear the masks. But as we just were told, you know, I shouldn't say nobody, most people don't want to wear masks. Most people don't want to be told to wear masks. But I can tell you, nobody wants to shut the government down again. Nobody wants to shut all the businesses down again. And the way to deal with that is wear a mask. If everyone wears a mask, we won't have to get to that point of worrying about whether we're going to shut down or not. So I can't urge people enough, wear a mask, wear a mask, wear a mask.
I would, as a follow-up to that, to Executive Budish's point, I think as we've been operating to date and looking at some of the dine safe orders around crowding and the like, if we find places that are continuously sort of ignoring what is required, then we'll be working with our communities and our county administration and other authorities to address those. But what we're looking at now is just give people time to understand and comply and get most people moving in the right direction. I think 100% compliance is unrealistic, and we need to think about now what people need to do to understand what is required and why it's required. And then if we have folks that continually ignore the requirements, then we'll address those appropriately, which may involve some escalated response. But this is the beginning with a new order that we now take it very seriously, and people need to understand how we can help businesses to meet this on their premises, how people can protect their family members when they're together indoors at parties, in groups, and recognize that this is a life-saving. It's amazing to think that a piece of cloth could be a potential life-saving mechanism, but that's basically where we're at in this circumstance, along with social distancing and the other related protections.
Thank you much.
Thank you all. I think that's it. Bill Shield from Channel 8 just texted asking, do we think we've seen any success with the use of masks yet, or is it too soon?
You want to go ahead, Terry?
Please, Armond, I'll wait. Please.
I think it's too soon. The order from the governor just went into effect. The city of Cleveland's order it doesn't even have its enforcement set up yet. That'll be coming shortly. The county's ordinance is still pending. So I think it's way too soon.
Thank you. Thank you, Armond. Thank you, Terry, Donna, Dr. Gullett. Thanks, everybody. And media, you know how to get a hold of me. It's Mary Louise if you have a follow-up. Everybody, thanks again and have a good weekend.
Thanks, everybody.